This is the Zemar Podcast. Elite Benefits of America helps small and mid-sized companies with their health insurance programs. And now, your host, Butch Zemar.
Welcome back to the Zemar Podcast. Today in studio, I have Daniel Wells from ClaimDoc. He's going to help me share some of the insight of what ClaimDoc's doing, some of the claims problems we're having, and what some employers could be doing. Welcome to the show.
Well, thanks. Thanks, Bush, and thanks for inviting me. And I'm glad I'm in studio down on the south side.
Yes.
I had to switch out my Cubs hat.
Yes, yeah.
Well, but happy to do it. Happy to do it.
I was going to say, thanks for making the drive down and being in studio. A lot of people just prefer the phone call, so I appreciate you being here. A little bit different experience, I would say, because especially the interaction. Can you give our audience a little bit of background on where you come from, and then a little bit of background on ClaimDoc?
Let's see, it's only a half-hour podcast, so I'll do
keep it simple.
The Cliff Notes. I've actually been in employee benefits for about 28 years. I was with Travelers when they had major medical and helped with that transition when United and MetLife bought them to Metro Health. And I was originally from Salt Lake and did that transition and then started my first third-party administrator, my TPA, which was Managed Care Administrators out of Salt Lake. Went to the Bay Area for a while and helped start up a TPA in the Bay Area. And then I got into electronic distribution and was one of the first employees at eHealth. I helped eHealth, I helped Extend Health, and then what brought me to Chicago was Go Health, transitioning them to be a call center for the ACA and AEP. But really my forte and what my drive is the risk, is to try to understand the risk in employee benefits and the fact that this country spends so much money, $2 trillion a year on health and care, and our outcomes are low. I mean, it's not worth that money. So that's really what's got me going. ClaimDoc was a really good fit. I've worked both on the provider side with revenue cycle management companies, but I really like the payer side because I think that's where the impact is the people who control the purse strings. ClaimDoc is, reference-based pricing is what they used to call it. It's more descriptive to say it's a negative replacement platform that not only gives you a different platform on how do we pay claims instead of a wholesale price discount. Why don't we figure out the cost of healthcare? And it differs around the country. It differs by specialty, and it differs by the patient. What that provider has to provide to improve our outcomes, and that's where ClaimDoc comes into play. They not only look at what's a fair and equitable reimbursement for those claims, but also a 360-degree look at risk mitigation, but also claims auditing. And everything's done in-house, which is really unique for vendors. That's, in a synopsis, that's what ClaimDoc is, and that's what we do. So we are reference-based pricing, but it's more holistic than that.
I actually want to take you back in time just a little bit and your experience with eHealth, because, and correct me if I'm wrong, eHealth created a platform for the individual space. Is that correct? And then eventually they moved the group?
Yeah. eHealth, when I first got there, they were actually doing Medicare and individual. We transitioned because Medicare wasn't really selling. I mean, when I started in 1999 at eHealth, I was a carrier relations director. So I was going out to the legacy carriers and trying to convince them that online marketing was a viable alternative to over-the-counter sales, especially on the individual market where at that time, and I think still today, it's more of a commodity. So it's that education of the end user, the insured. And so that's what I did with eHealth. I went to Extend Health in 2005 out of Salt Lake, and that's when we transitioned to that individual platform, that sales platform, and incorporated group health into that with the HRA. And this was prior to that actually being legal in 23 states. So we ran into some regulatory issues, but it was legal on the Medicare side. And so when I went to Extend Health, we did the first private exchange to transition legacy retirees, mainly for the automotive industry. GM, Chrysler, Caterpillar were our first clients, and set up that HRA platform to give retirees that bucket of money to go out and shop the open market for Medicare supplements, Medicare Advantage, and Part D programs. And I set up that arrangement, trained all the agents in that call center out there. They were bought by Towers Watson for $400 and some odd million bucks, and that's still that business model is still one of their cash cows.
Interesting. And now transition to GoHealth. It was more specifically in the individual market, or did you help build platforms or help work with them because they started tampering with groups at some point. I just don't know when. They were more in the individual market.
When I went, they weren't even called GoHealth. They were called Norvax.
Yes, I remember that.
They were basically a rating engine platform that sold to individual brokers. I came into GoHealth in 2010, and this is when the ACA was going on, and helped them transition and build a sales team in the in-house agents in downtown Chicago, which is probably not the most cost-effective way to do it. But then we started taking over. Coventry was our first client, and when the healthcare.gov imploded, we had to do something. And so the private market had already had that. eHealth had already had an individual marketplace that somebody could go to and shop. We just didn't have the financial component and that risk adjustment component that was part of the ACA. I helped GoHealth train all their agents and get that platform up and going. And then 2 years later, we signed Anthem and we started doing the AEP for the Medicare side.
Yeah. So I guess where I was going with a lot of it is that there's a lot of technology that was bringing in your experience, and then of course analyzing the risks. You weren't necessarily on the retail side like I am, and bringing that to ClaimDoc, right? And that's where I was headed. Where ClaimDoc with risk analysis. I'm actually curious on some of that past experiences. How's that coming to the light now, helping brokers such as myself building these plans for employers?
At that time, it was still just a commodity. We were retail. Our production was astronomical with these carriers. Retention wasn't good because there wasn't that relationship that traditional agents have with their clientele, and that hurts. And there was no vision on risk. I left eHealth and went to Washington, D.C. and helped a company called Hcentive. We built the shop portal on healthcare.gov and put that risk component in there because of all of the different divergent platforms, the legacy platforms with the traditional carriers. That was a heavy lift. And I think that's why that never took off, is because we could never understand that risk adjustment factor and figure that one out. That's why I jumped back into the self-funded, because then I can look at each individual group, each individual scenario to determine that risk and determine a platform that will help those groups. In the individual marketplace, and even in Medicare, it's really hard to understand that risk, even with all the big data that's out there, to make it actionable. I mean, you can run these algorithms, you can figure that out, but you need that data to become actionable when in the marketplace. And I think that's lacking in the smaller group, and especially the individual in the Medicare marketplace. For sure. So now with you moving back to self-funded, there's obviously risk analysis involved. Are you seeing a trend where employers are a little bit more open-minded to moving towards self-funded groups? Yes. And I think it's more because of just the cost savings. And I think it's the C-suite, the CFOs, that are looking at their expenses. And we're 2 to 3 on their expenses in these companies, and it's uncontrollable. And they don't have any insight to that. They have insight to their labor. They have insight to their suppliers. They don't have insight into their benefit packages. And that's why they want to actually start peeling those covers off. You have some of the commercial carriers that are starting the ASOs or starting to give you some of that data back, but it's not actionable. Again, I go back to that actionable data. Self-funding gives you that. It's very specific. We know who your cost drivers are inside that group, and we can mitigate that while improving outcomes as well. And so it's not just what's my renewal and I want to go to the cheapest renewal. It's where are my cost drivers and how can I impact that year over year? It's a long-term strategy. A lot of the brokers out there are starting to gravitate toward that. I wrote a self-fund, I hate to say this, but my smallest self-funded group when I was a broker, because I used to be on that side as well, was 5 lives. But it made sense for that group. Right now, ClaimDoc will go down to 50, but it has to be a very unique situation where they have good control, stability in their workforce, where we can impact that. Because when you have a lot of turnover, when you get those smaller groups, it's hard to really have actionable data again, because you don't have the longevity and that long view of what that risk is.
So on previous podcasts, I've actually talked about there's two pieces of the puzzle that we're trying to solve. One is the funding of healthcare, and then there's the that's when you pay for it, and then the expense side, right? And a lot of brokers are my peers, right, across the country, and there are a lot of great people that are in our industry. They're not trying to do harm, but they focus so much on the funding side, right? They're trying to raise the deductible, get the premiums down, how we're paying for this, how we're paying for that. But then there's the expense side, and it seems like brokers stop at that point. It's like on the 1 yard line, and they don't focus on like how are we spending that money. And that's why like a lot of them, they're married to some of these legacy carriers, as you put, and so they don't give the data. They don't have it. So you could even some of their quasi self-funded platforms don't give everything. And so how do you go through and see what those expenses are and then what's being paid? Because how many things, and I'm sure you got some data, and we'll talk about some case studies that I found on the website that were public, that how many things are overpaid in the claim data?
Any facility charges overpaid.
Any.
And I've talked to hospital administrators, and like I said, I was on the provider side doing rev cycle management, and there are errors in 100% of all facility bills. So the provider side, which is not your cost driver, there's not as many, but there's no coordination of care as well. And coordination of care is not just the providers to like providers and making sure that we're referring you to the proper people. It's also to make sure that member has compliance, that member has incentives to finish that prescription. The member has the incentive to go to physical therapy or occupational therapy and do the aftercare that's really needed, not only for their quality of life and to improve outcomes, but also to mitigate those expenses on the backside. You don't want readmissions. You want people, if you do a knee replacement, you want them playing hockey or skiing like I do, in the next year and enjoying life, not having aches and pains, especially as it goes later in life.
Yeah. So how is ClaimDoc trying to manage that risk? So you have somebody internally, or is there partnerships that you guys work with?
ClaimDoc does everything in-house, which is very unique, but it also allows the teams, and it's on one platform, one system. So the teams know that life cycle of that member, be it the onboarding, the care manage or the account management. We have case management in-house, but we also have clinicians that do bill auditing in-house. So we are looking forward. We're being proactive to figure out what's going on within a group, making sure that we do have the proper care, making sure that we've done outreach and we have access to providers for each group to improve those outcomes. So it is a very a holistic approach. Our clinicians do a line item by line item review. We're not a repricer. Repricing and auto adjudication is a 4-letter word for us. We look at every single claim. And through our proprietary systems that are in-house, we can do that, and all of our teams communicate. So if our care management team sees that a member needs aftercare at a certain facility, they'll reach out to what we call our member advocacy group. They'll reach out to that facility before an appointment's even scheduled to grease those skids, to make sure that we have a smooth transition and we have the data available to improve those outcomes, but again, control those expenses.
Yeah. So can you walk our audience through, somebody obviously we can't do this on a fully insured. It fits far better. The shoe is better on a self-funded platform. Employee goes, presents the insurance card, claim gets submitted. What happens from there, and where does ClaimDoc get involved? And can you walk us through how ClaimDoc from start to finish? Just a good summary of it.
Sure. So ClaimDoc is not a TPA. So we work with TPAs. We work with direct primary care. So that claim gets submitted. If it's outside, so if it's a direct primary care, it's going to go there. It's a capitated site type of arrangement. If it goes to the TPA will send it to us just like they would a network. You know, if you want to look at it that way in the traditional sense, we'll look at that claim, review that claim, do our line item audits, and negotiate that claim to an equitable fee arrangement. Now, our fee arrangements are, we'll start out with Medicare plus 20% or plus 20% of their cost list, which they have to do now with the ACA, whichever is greater. We're not here to shortchange the providers. We're here to make sure that it's fair and equitable. And then that's how we'll send it back to the TPA. They'll pay that claim. If a balanced bill or something comes up with that reimbursement, we have a balanced bill team that'll reach out to the provider. And a lot of it times it's because of the revenue cycle management companies. They do this third party on the provider side. They'll kick it out because they won't be able to attach it to a network. And that's a lot of these balanced bills. It's a simple reason. You call up, you explain how that reimbursement was made. 99% of providers say, okay, and now they can book it. And then my next member who comes into that provider, we don't have a problem with. If it's a hospital claim, we'll do an audit. We request a line-by-line bill. We'll do an audit on that bill, and then with our reimbursement to facilities, we supply our audit report. So if it's an unbundled, bundled, if it's a duplicate charge, if it's a facility acquired condition, we're not going to pay for that. There's no reason why a plan sponsor should pay for a facility acquired condition. So we'll negate all those and send it back to them and say, here's our explanation with a check. And if they come back further, we also have our own legal department. We don't use the FIA group, which is I love Russo and his team up in Boston, but we do everything in-house, so it's all coordinated. And then we'll take care of that. One thing that we can say is our plan designs, the member will never be responsible for anything above their out-of-pocket. The plan itself, the plan sponsor, will never be liable for anything above the maximum liability. We at ClaimDoc actually take co-fiduciary responsibility. So if we have to negotiate a bill and it happens to fall outside of the stop-loss contract, that's on us. We'll pay that delta. This helps us with our stop-loss as well. You'll get a lot of reference-based pricing vendors out there that'll say, hey, we can save you 10, 20% first year. Good. Let me see it in my stop-loss rates that first year. We get those stop-loss discounts because we work with our stop-loss carriers. They understand what we do. And they also understand that we do take co-fiduciary responsibility to cap those costs. So the stop-loss carriers are more comfortable with dealing with us. So it's really more of a holistic approach, and that's how that process works.
Yeah, I mean, so that was the long version. A short version, and this is you can go to the ClaimDoc website. We'll have it in the show notes. But like the first one, this is just from I think February 2023. I don't know a specific date, but so I just printed this off this morning. So these are fresh that were published. There was a surgical facility treatment center that a procedure was done. And there's more details to this on the website if you want to read it. But the total surgery bill to the insurance company was $70,169. So ClaimDoc did their work, right? Went through that whole process that you just explained.
That line item audit.
Yep, just went through it all. Contact every person that's part of the team to make sure it all. And so that $70,000 bill came down to $5,091. And so it saved the plan $65,000, which they put a reduction percentage of 93%. I mean, that's the big picture, right? And so when you look at some self-funded groups and some of the smaller groups, if you want to call it that, even under 100 employees, they get a little nervous, right? One claim is going to skyrocket, right? So they need somebody in their back pocket. ClaimDoc is just obviously one of the bigger ones out there that you could have somebody review these claims so that you don't have to. Like the employer and the CFO doesn't have time to do this, right? The TPA isn't, I mean, they're just the administrators, right? So they're not doing it, but so who's analyzing these claims, right? And that's the problem that a lot of union plans have, right? They just keep writing these checks and the healthcare fund keeps running out of money and they keep asking the members to pay more. And that's a whole other topic we can get into. But here, instead of having $70,000 come out of the claim pool, right? Now you're only getting $5,000. So it frees up cash.
And surgical centers are notorious for that because traditionally, I mean, the legacy process is wholesale discounts.
Mm-hmm.
And so they're going to charge that. And the charge masters, especially with the transparency rules, everybody has to list their list price out, their wholesale price out there. And so you have these centers going out and they want to be, and they'll just match the highest price. So what you're going to see with this transparency issue is everybody's going to be at the same level, and it's not going to be a discount. It's going to be the highest wholesale price out there. That's what happened in this particular case. So we went through and looked at that, and I think we update these all the time on the website. This is bundled versus unbundled. So this should have been a bundled service. They charge us the bundled rate, and then they charge us line item for unbundled services that should have been rolled up into that. That's how come that was such a steep discount.
And that makes sense. And then even so just to transition to fully insured, right? This happens all the time in the fully insured. And in my past podcast, I've been talking about my son, and he had a procedure. And so we had a local hospital that he had the surgery. And so even though we're on a fully insured platform because of the size of our company, that they did the exact same thing. And the insurance company was like, no, it was like $8,000. They're like, no, you already billed this for this on another item. And so I'm glad some insurance companies are sticking up for it, but which ones are not, right? And that's the problem. And all these claims are, and then just recently another podcast, I think it's going to be released here shortly. I talked about there was a study, I think it was in Maine, where one of the legacy insurance companies actually lost in court because they would pay the same exact claim differently depending on who the group was. And so some would pay more, and then others they would scrutinize. And so obviously it's just the wild, wild west, right?
You have some. I have an example with Anthem that paid overbilled charges. And you scratch your head. And when you do self-funded and you go the traditional PPO network, you're leasing that network, and the provisions in that contract, I'm going to pick on Cigna right now. You do not have audit rights. So whatever Cigna says you have to pay as a plan sponsor, you have to pay. And that's just not right.
Yeah, and I've heard that with contracts that are out there employers sign, and most employers don't read it. They don't have it reviewed, and here it's costing the pool more. But then employers are going to say, well, what about all this premium? It keeps going up every year, but we're not trying to control some of the costs.
Hey gang, ever wonder what it's like to be a small business owner? It's confusing. Weird expenses coming out of nowhere. And when you throw in health insurance, forget it. Nobody understands how that works. If you own a business, big or small, it's one of the biggest expenses you have all year long. And yet, we all wait until open enrollment at the end of the year, and then we think to ourselves, next year I'll get a jump on it. And then it's another year of paying way too much. If you're a business owner, big or small, HR representative that wants to impress the boss, give Butch Zemar of Elite Benefits of America a call. Save yourself or your boss thousands or even tens of thousands of dollars a year. Reach out to Butch right now, 708-535-3006, or shoot him an email, butch@elitebenefits.net. And be sure to check out the Zemar podcast. Don't wait till the last minute. Put Butch Zemar to work for you now.
What do you see from your seat working in ClaimDoc and your experience in the industry, where things are headed?
I want to work myself out of a job, but what I want to see is I want to see providers and facilities empowered to figure out what their actual costs are and become really that partner with the patient, not the payer. The payer should be last on that totem pole. And I'm hoping so. I'm working right now with a hospital association, American Hospital Association, because they're pushing back heavy on reference-based pricing. But reference-based pricing has really improved over the last 5 years, where it's been more holistic of, we're not just going to say we're going to reimburse Medicare plus 20%, and then the member has to deal with those balance bills. We're actually looking at the care, looking at outcomes. I think the risk sharing that is part of the Affordable Care Act, once we start doing those ACOs and they get traction, I think that we can transition away from the secret sauce of the commercial carriers network contracts and get into really transparency, where you can go to your doctor and say, hey, I have a cough. What's it going to cost me? Or you go to a hospital and they're going to tell you up front. what their actual cost is, and then they're going to compare that to your coverage and tell you what your out-of-pocket cost is, but also provide that data to the ultimate payer, which is the employer in most cases, or it's going to be the insurance carrier.
And you bring up a good point. So these ACOs, which are accountable care organizations, right? And so they've been in the works for some time. This isn't anything new. And so you actually think that that's going to take off a little bit more and more as time goes on? Yeah.
In my rose-colored glasses, if you actually read through the Affordable Care Act, which I did numerous times, if we enacted each one of those provisions and they grabbed hold and you didn't get the pushback from the status quo, both on the agent side, the employer side, and the payer side, we would actually be able to, just like we're doing in self-funding, look at what our cost drivers are in this country and enact mitigation standards to not only reduce those costs, but improve outcomes. Pre-diabetics, hypertension, those are huge. I mean, cancers are a hit and miss. We know some of the risks associated with cancer, but diabetics, type 2 diabetes is preventable.
Mm-hmm. Yeah, for a lot.
Hypertension is preventable, and they go hand in hand.
For sure.
I think respiratory diseases too, and it's all about inflammation. And if you look at on the clinical side, we don't have a good grasp of that globally. And I think that our fragmented healthcare system in this country, we need to fix that. And it has to be driven on the providers, not the payers. It has to be driven by the old doctors and have them look at their patients and want to get their patients better, not looking at what the profit is and gaming the system to make sure they get maximum reimbursement from a tertiary payer, the third-party payers. I'll get off my soapbox now. I think that we need to start driving this from the ground up instead of the top down.
I agree. It's going to have to, right? I think employees and policyholders are going to have a little more skin in the game by taking responsibility, speak to their employer, get their employers are going to have a speak up. I mean, some of them just turn over and just say, "I'm that," like they don't know what to do anymore. And they just, some of them throw up the flag. I mean, some businesses have gone out of business because healthcare costs gone through the roof. There's a guy, I think he's out of Wisconsin, that wrote a book that about how he researched all these ideas and then it saved his company because he was on the verge of bankruptcy and purely because of the high cost of healthcare. And so he had figured out ways to reverse the trend. This is years ago before ClaimDoc was even around, or even maybe the reference-based pricing idea in general. But speaking of, so at ClaimDoc, I was trying to see what they were up to these days before our interview today, but it sounds like this year's a year of celebration for them.
Yes.
They made a decade.
They made a decade. Bruce, or Ben, who's our chairman, who you interviewed 2 years ago, actually it was. It's his company. He was running a captive, had PPO networks, couldn't control that risk, and came up with this idea of ClaimDoc. So we're privately owned. We don't have any investors in there. It's Ben and Bruce, who's our COO, who own this company. Everything is in West Des Moines. We're under one roof. We had, I think when Ben was here a couple years ago, he had just closed on our new
facility.
Offices.
Yeah.
30,000 square foot. I spent a few weeks out there. Beautiful facility, room to grow. But everybody's under one roof. And there's a good pool of workers out there in Iowa to pull from. And we had a boom, a banner year last year. I only came on in August over here, but we're seeing more and more people, especially when you come off of other reference-based pricing models, and the fact that we integrate really well. We can do a dual option where you'd have a PPO stand against a reference-based price model and let the member decide. We could incorporate DPCs. We can incorporate community hospital plans into our system because we have that steerage built in. We have those member advocates. We have our member services teams that work hand in hand to really steer them. And no matter what your plan design is, if the member actually takes our advice and goes to these members or does aftercare, we'll reduce their costs or give them a check back for their out-of-pocket expenses and make it zero cost for them to obtain their health care. That's the patients and the members' incentive. And then, like I said, this risk sharing, with the ACOs, when that takes off, that's only going to incentivize the providers to sort of kick out the legacy carriers, the legacy payers, and say, we want to take control of our own success. Yeah,
for sure. Now, with obviously celebrating 10 years and a lot of growth and insight on the future, and a lot of things are moving more technology driven, tech stack, right? And so, what does ClaimDoc have any plans in the future of doing more integration or more tools to the policyholder to help make this claim experience a little bit more positive going forward?
Yes, we are.
Okay. Yeah.
Yes, we are. But it's because the data sets that are out there, trying to make them actionable. I'll go back to that. We have all this data, but how do we make that actionable and reasonably understandable for the member to actually digest and make educated choices? So yes, we're moving toward that. We're moving toward more self-service where the member can go in. Our Pave the Way program, which is our onboarding program, you can nominate doctors, but nominate facilities, so we can do proactive outreach. But I think we need to integrate with some of these wearable devices and make it so you have a one-stop shop where a member can log in and look at all their readings, look at what's going on in their body, look what's going on in their activity, and see what their overall cost is, and project that to the individual member. And I think that's probably the next step in this, is where a member can act instead of just the plan, go down to the member level where they can look at their expenses, they can look at their outcomes, and then they can take control of their own healthcare.
I talk about it on the podcast. They got to take more responsibility, not use it like an open credit card. And I compare it to other insurance products when we talk about what is insurance and what is it really supposed to do, just from a general purpose. And so when we look at our homeowners insurance, right, like I think the healthcare should be the same way, where the owner's involved if there's a catastrophic loss or some type of repair that needs to get done that are bigger than maintenance, and they're involved in the process. They're worried about the cost. Okay, even though the insurance company is going to pay, but they know it's going to be kicked in on the back end. But homeowners insurance is really affordable. Same with auto insurance is compared to health insurance, but we demand so much out of it, but then we have no idea what.
We give so little into it. I mean, I would say the auto insurance. Look, you'll get a discount if you let your auto carrier track your driving habits. Now, what if you did? And nobody will do that with health. They're too afraid, but they'll do it with their car. But I think that's where we need to sort of go.
Yeah, and you're right with it coming up on these mobile devices. I always joke, I tried to become an ultra runner. I mean, I did accomplish 50 miles at one point. I do have ambitions to do 100. But if I only had a dashboard that actually give me readings of what I shouldn't do, my life would be a little bit easier. Not only just from a endurance athlete perspective, but life, right? Like, because there might be days that you feel a little off, but your dashboard says you're good. You don't want dummy lights. Yeah, you want to see what's going on.
And we need to aggregate that data. So your Dexcom doesn't. So my shout out to my Oura Ring, which I love, because I can check everything. I can check my O2 levels, all my respiratory, all my my heartbeats, and see what I'm doing. But if I have all these different devices, I have to go to all these different platforms to do that. We need to aggregate that so it's easy for you guys to look at that. And also for the patient to understand where they sit, but also for us to look at that patient and do maybe some outreach to get them either off the couch or to get them eating better. Nutritionist is going to be the next foray into adding that to your benefits, adding nutritional benefits into a plan design. I think will be a huge step forward.
So obviously, not only ClaimDoc, but the experience and the claim savings that it brings to the table, employers may want to get access to this, right? You mainly, I think, 100% work through brokers and TPAs, right?
Yes.
Yeah, and so you don't do direct business.
Don't do direct business, but if any employer out there wants to reach out and learn more about us and then bring it to their broker or have their broker contact us, I'm all for that. And we have that all the time. As a company will see something that we're doing, and we'll get the CFO reach out and ask us questions and see if he can work with us direct. I don't want to, butter my bread on both sides. And we really need the advisors out there because they have a better feel for that client and what's going on in the business of that client We know of their risk on the health side, but you really need somebody out there who's the advocate for that employer. But yeah, they can reach out to us. Their brokers can reach out to us. Usually what'll happen is I'll talk to the employer. I'll ask for the broker's name, or I'll say, just have him give me a call or her.
Yeah, I was going to say, how do they get in touch with you?
They can get in touch. Go to our website. It's claim-doc.com.
Awesome. And that's where I got some of the information that for this podcast today. So you can go to the website and you can pull those case studies and kind of get an insight, and then reach out to even Dan. I'll have them in the show notes. You'll be able to reach out directly.
Thanks.
All right. Thanks for coming down to the South Side, and hopefully to have you back again.
Yeah, I look forward to it.
All right, thanks.
Thank you very much.